Hi, I'm Dr. Jason Glover from Rutherford Orthopedics. I'm board certified and fellowship trained in foot and ankle surgery. Moved here 14 years ago to escape the hard, harsh winters of Northeast Ohio. I love helping people. I love interacting with people. I keep things down to earth. I love having fun, whether it's in the OR, in the office. I don't view my job as a job. I love every aspect of it. You know, when I first moved here, I considered maybe this place as a stepping stone, maybe something bigger, you know, get established here, maybe go somewhere else. But I love Rutherfordton. I'm proud of being part of Rutherford Regional, and this is where I'm going to stay. It's a small community. Rutherfordton it's a small town. You have to treat people right. I mean, you have to be down to earth and treat people how you want your family to be treated. I kind of grew up in a smaller town. I grew up in Canton, Ohio. My mom is a retired church secretary. My dad's a retired tool and die maker. Went to school at Mount Union College, and then Ohio College of Podiatric Medicine, and then the Ohio State University for my residency. I checked out different areas, optometry, dentistry. I settled on podiatry just because of all the other specialties you can do within the field. I try and focus on the surgical aspect of it, but it's when when people come into the office, they leave feeling good. It makes me feel great. While in training, I was able to publish studies of foot and ankle surgery and different publications. I also wrote a chapter in a textbook regarding bunion surgery. Bunion surgery is probably one of my subspecialties. I perform what's called the Lapiplasty bunionectomy. There are over 100 different ways to fix a bunion. In my opinion, the Lapiplasty is the best way to fix a bunion long-term to provide long-term results without reoccurrence of the deformity. Lapiplasty is a three-dimensional procedure. It corrects 3 different planes as opposed to the older procedures, which you just cut the bone, shift it over. The Lapiplasty, you cut the bone, you rotate it, you do other things to keep it from coming back. Rutherford Regional is the Centurion Center of Excellence when it comes to Lapiplasty in Western North Carolina as well as a lot of South Carolina. Centurion Center means I've performed over 100 Lapiplasties. There are a few that may dabble in the procedure, do 1 or 2 every so often, but here we do 2 or 3 per week. Lapiplasty is pretty technical. There's a lot of steps to it. It takes, in my opinion, a lot of training to get the handle of it. And so whenever you find someone who has done a lot of the procedure, the results are more predictable. Yeah, it's offering people something different that other hospitals or groups don't offer. It keeps people in town, keeps people within our hospital system as opposed to referring them to Spartanburg and Asheville. I think that's one thing I like about our hospital. We have newer doctors, newer surgeons. We have different subspecialties, and with having the cath lab at this point, we take care of a lot of critically ill people. With this multidisciplinary approach, we can keep people here if they need a lower extremity revascularization in the cath lab. We don't have to send them to Spartanburg, Asheville. A candidate for bunion surgery is someone who has the deformity and it hurts. It's not cosmetic surgery. It's taking care of a bone problem. I perform a wide variety of foot and ankle surgeries as well as non-surgical treatments. But my subspecialty, the thing I love to do is bunion surgery and Lapiplasty.